Hi, everyone. Welcome to Chicago Autism Network's virtual parent workshops. Tonight, we are really excited to hear from Dr. Ashley Whittington-Barnish. Dr. Whittington-Barnish is a licensed clinical psychologist, a board-certified analyst doctoral, and a nationally certified school psychologist. She really just does it all. She has over 20 years of experience working with individuals with autism and developmental disabilities across the home, school, and center-based settings. And she is currently the clinical director at Stride Autism Centers. So I will turn the time over to Ashley.
Thank you, Kimmy. Thanks to all of you who are here. I am going to switch it over to share my slides. Okay. Perfect. And I do welcome questions in the chat as we go, and then there will also be a Q&A opportunity at the end. So today we are going to talk about journey to services. So from when some of those first questions come up, usually when children are young, sometimes a bit older, and then through diagnosis process to what does it look like for interventions and what types of things are available. So Kimmy already did a wonderful introduction, so I don't know that I need to go through this slide, but just a little bit of my background. I am currently a clinical director at Stride, and Stride does serve primarily kiddos from the ages of 2 to 6. So that's usually what my work is now. I have worked with learners throughout all the ages, primarily birth to 21, but some young adults as well. And had the opportunity to do a lot of my training through the autism program early on in my career at Illinois State University, and then have also taught BCB, many students who've gone on to become BCBAs through the Chicago School of Professional Psychology as well. A little bit about our plan for tonight. We'll kind of start with that developmental milestone, talking about that. We'll talk about autism spectrum disorders, what those core criteria are for diagnostics, looking at what an assessment and diagnosing kind of process looks like, what some areas of referrals would be, and maybe questions to ask or things to keep in mind. And then a little bit about ABA in particular, as that's the area that is my specialty, and then a little bit about Stride and some of the upcoming things that we have going on too that may be of interest to those in the area. So thinking through child developmental milestones, there are lots of different ones, from gross motor, fine motor, and social skills are the ones that are shown on this slide here. When we are talking about many of autism and autism kind of related disorders, we're often looking at more the social and communication. However, there may be other milestones that might not be hit when planned. What I like about this particular visual on these slides is that there's the nice, like, both words and pictures. And it's really, if those things are not hit by the year above in the column, then those would be the times that you'd want to ask some questions, both of potentially a pediatrician, but perhaps, looking at other potential services as well. So, by looking at the social skills ones, starting to play or being interested in other kids around 2 years old. And then even by 4 years old, playing some group games, separating easily from a parent, and being able to kind of navigate those different types of social situations. Other ones to kind of think through would be for hearing. Again, a lot of times if there's concerns with speech and language, those are core to what we see oftentimes when we're leading up to a diagnosis or potential ABA therapy. And a lot of times hearing screenings or hearing evaluations could be a rule out to make sure that there's no issues with that are impacting language or speech development. And then this kind of goes through the different, so the hearing up through like following simple directions, and then vision, starting to sort, maybe noticing the different colors, looking at different objects in those preschool years. And then for language, we're looking at, and again, you can't see because of the way the slide cut off, I'm sorry, but the last two columns are kind of 2, 3, and 4, or the last 3 columns, I'm sorry, are 2, 3, and 4. So making simple sentences, asking and answering questions, and being able to tell some stories. So these are a lot of the times where we'll see some of the developmental questions about autism or maybe a developmental disability more broadly kind of are coming up during these milestones, but particularly the middle to the right side of this particular visual. And then oftentimes through the process of assessment, we also are looking at self-care skills. And so sometimes there could be cultural differences here. There could be differences in what children have had the opportunity to do. So this can also, as a parent, just kind of help you think through like, oh, are we even giving an opportunity to eat with a spoon, or giving them the opportunity to kind of pull their own arms out when they're undressing? So this can kind of help kind of cue. A lot of times pediatricians will use that ages and stages questionnaire to look through like where are some of those things. But this visual can also help with that. And a lot of other information is available about what the basic milestones are and where there might be questions. So what do you do if you do have some questions about some of these things? Well, if a child is under the age of 3, I highly recommend looking into the early intervention services. So in the state of Illinois, you can contact the family service coordinators in that agency. It's based on where you live. So each county is different. Service Inc. is one that's very common in more the southern suburbs. But they will do free evaluations or assessments for early intervention services from birth to 3. And so I often, if families are starting to have questions about this, I often refer to have these types of services looked at. They're usually multidisciplinary, they're in home. Depending on what your concerns are, you'll go through a process where you'll do an interview with a service coordinator, and then they would send out, let's say you have speech concerns, they may send out a speech therapist and a developmental therapist, or maybe if there's physical therapy concerns, they'll send out a physical therapist, and they'll do an additional assessment and with your child and with you or the caregivers. And then if appropriate, set up a treatment plan and go through services through that. Again, this would only be available till 3. So then once children would be either aging out of early intervention services, or perhaps some of these concerns come up after the age of 3, then I would highly recommend, depending on what your needs are, contacting the school district. And school districts usually do evaluations starting at around 2.5. School districts will advertise them, in local preschools and things like that, or you could contact your local school district to do an evaluation there. If your child's already in early intervention services, oftentimes they'll set up for you what those transition services would be to those next steps. So sometimes it's really just kind of taking those first steps, which can be very challenging. And, there's a lot of questions about like, well, what if I do have concerns and they're not valid or anything like that? And I would always encourage parents to try to just explore it and to see what other next steps might be available. Okay. So I know many of you are here because you either have some interest or perhaps questions about autism spectrum disorders in particular. And so this is defined using the Diagnostic and Statistical Manual, 5th edition. So the DSM-5 is often you'll hear referred to, and that is really what psychologists and other medical professionals use to diagnose. So to look at and see if this particular pattern of behavior, of communication fits the definition. And so part of my job as a psychologist when I do diagnostics is to look through the diagnostic criteria and evaluate if that fits for that particular individual. And so in general, autism can look very different across different ages, across different individuals. And the core symptoms considered through the DSM are persistent deficits in social communication and social interaction. And so what this means is that not only like a deficit or maybe not hitting milestones in speech, but a step further. So the way that social interactions may be too much for that cultural norm, too little, maybe a little bit awkward. And when it says across multiple contexts, it means that it's not This isn't for a child who may be kind of shy or acts a little bit differently than expected, or maybe not talk as much or talk, maybe in a baby talk voice in one particular setting. So if that would be like just in the home setting or just in a school setting, or maybe just when it's a new environment. So across multiple contexts means that we see this happen across. So maybe it's happening in the clinic during the diagnostic, the parents also report it, teachers report these symptoms. So that's the first core area. The second core area is really looking at restricted, repetitive patterns of behavior. And so this is probably the area where it looks so different for so many different individuals. So this may mean really repetitive vocal behavior. So maybe it's saying something over and over again, or saying scripts or like little snippets from particular movies or TV shows very frequently, or really, really interested in one particular thing. And a lot of kids get really focused on specific things and kind of go through phases. And so this is where it's the job of the diagnosing physician, the psychologist, to determine if this is something that is within kind of that range of what neurotypical children may do at that particular age, or if it seems a bit more intense, or maybe there's a lack of interest in different things as well. So this could be, just kind of an unusual set of interests or activities. The symptoms also have to be present early in the development. So if an individual, maybe a young adult or an adolescent, has some of these things, but they weren't present, it doesn't mean that the person needs to be diagnosed when they're very young. However, those symptoms have to be present. So if reflecting back and looking at the developmental history, there wasn't evidence of restricted or repetitive behaviors, or there wasn't a deficit in social communication, then they may not fit the criteria for an autism spectrum disorder. And it doesn't mean that it's explained better by a different disability. So this could be like an intellectual disability, or a particular speech and language disorder that doesn't better explain it, or even an acquired or traumatic brain injury. So that's kind of how the nuts and bolts of how professionals look at and determine whether or not a child or an individual meets those particular criteria. I also will say one more thing actually about that, is that sometimes we'll hear, adults or others say that somebody used to have a diagnosis of Asperger's or autism, and now with the DSM, they all fall under that category of autism spectrum disorder. So they don't kind of separate it out into the different things that used to kind of fall under what they referred to more as the umbrella. Now it is just one disorder, technically, with those particular criteria. So sometimes I get asked, like, why is it important? What is the point of diagnosing? And this is a really important question today. And when we think about just the continuum of neurodiversity that exists and should be celebrated, and how different people think differently and different people behave differently, and that isn't bad or anything like that. What I generally say, for if people are wondering, like, what does it matter? Do I get my child diagnosed? I don't know about having a label. Is that oftentimes, for better or worse, in the society that we live in, it allows for access to services. So having a diagnosis or a label, really among lots of different areas, not only in developmental disabilities, it allows for that common language to describe that set of symptoms, that core symptomology that can explain to other professionals. It also allows oftentimes for access to different types of services, access to insurance funding for different types of services. And so although there's a lot of, different questions about what to think through when you might be deciding about what next steps to take for your particular learner or your family, or you're even working in the field, it often comes down to those core, like, what can you access? in terms of where to kind of start. So let's say, maybe you've already looked at the EI information and you're asking for the next steps for a child of a certain age, or perhaps you are, um, it could be that, you're really ready to, people have said, or the pediatrician has said, I think that this is something that maybe you should look into a little bit more seriously. Sometimes the doctors may have referrals or different professionals that they work with. A lot of times hospitals have um, diagnostic areas. Some nonprofit agencies also offer diagnostic services. And then this is an emerging trend more so, I see now, is that many ABA companies are starting to have diagnostic services available. And that's really much because there's such a backlog, partly because of the pandemic, and doing diagnostic services was very challenging during the pandemic because of the use of, well, just because of people not being together, but then because of using masks and how that made it even more challenging to diagnose while using masks. And we'll talk about the ADOS, or the main tool used for diagnostics. And for a long time, that not being able to do that with masks, because you can't probe the different types of behaviors and social cues as well with masks on, that they were not allowing, like the technically norm referenced or uh, ADOS scores to be scored if masks were worn by either the professional or the individual. And so that all kind of caused this backlog of diagnostics. And so because there was a pause for a while, because there might be an increased interest in getting diagnostics, there is a large wait list, many different places. And I think that's what's also pushed many ABA companies in wanting to help provide services as quickly as possible to people. And the diagnosis is such an important tool to reach that next level. Okay, so that is actually one of the reasons too that Stride has kind of starting to move into this diagnostics space. And so helping with that bottleneck that I was just talking about, and really the goal of providing services, or at least providing the option of services to as many people as quickly as possible. What we do know about applied behavior analysis services and really just access to intervention overall is the sooner the better. And so the sooner that we can get individuals diagnosed, if they're waiting to access treatment, the sooner that they access that treatment, and then the sooner that they're making gains and meeting goals. So currently at Stride, I do, we have a small amount of diagnostics. We're working on helping to decrease that wait time for services for individuals across. And so we do have diagnostics available for private pay, and we're hoping to move into private insurance in the near future as well. So I do want to kind of put that out there too. If people are looking, it is one particular place. But like I said, there's hospitals, nonprofits. I do recommend, if it's something that you're thinking about, to get on waiting lists for that, because they can be very long. So let's say you're going to have it. I kind of scoped this to be all different areas. So the next step would be, like, you're going to have your diagnostic evaluation for your child. I guess I don't know if the people listening, if some of you are parents or some of you are individuals that might be looking for self-diagnostics, but just in general, the process includes usually two main components. One of them is getting information, usually from a caregiver, or if an individual is older, some of this might be self reported as well. And that's getting some background information through interview and through rating scales. And so these can be done electronically or paper and pencil. And the main areas are going to look at those core areas that I mentioned. So social and language skills. So there's some rating scales that are really specific to language development or social skill development. And then information about repetitive behaviors, any, repetitive language, things like that, as well as adaptive skills. And what that means is those are those self-help, self-care type skills. So washing hands independently, eating independently, brushing teeth, helping get dressed, whatever would be considered kind of in that age age appropriate range for the age of the person who is going through the diagnostic um, uh, interview or rating scales. And so oftentimes those are, again, reported by the caregivers, reported by those particular individuals. And then there's usually another component. Sometimes it's a separate day. Different places set these up differently. Some places, especially large university hospitals, will, when people travel far, they'll try to do all of these things in one day, and they may have different professionals doing different parts of this. So you may have a social worker doing part of it, or a developmental pediatrician doing part of it, and a psychologist doing a different part, or a speech and language pathologist doing another, the language assessment. So it may be broken up by different professionals all in one day. It may also be multiple appointments throughout, the course of a week or a couple of weeks. And then, so that other component, that really important piece, is that direct observation with that particular individual, with that learner. And so some clinicians will use the CARS, which is the Childhood Autism Rating Scale. And that is one way that, doing some observations and getting some parent report, it can be scored. What's considered the gold standard in autism diagnostics, whether we're looking to make a diagnosis of autism or to rule out a diagnosis of autism, is the ADOS. And so the ADOS is in its second edition currently, and that's what the picture on this slide is of the ADOS kit. And so you see there's plenty of different toys and books and things like that, and there's all different activities that clinicians will do. And there are different modules based on the age or the language of the individual being referred. So there's a toddler module that's really for the very young children. There's also then modules 1 through 4, where one is the usually the younger or less language, and then 4 is more language and generally older. And so based on both language skills as well as age, the clinician determines which module is most appropriate. So for some of the young children, there'll be different tasks with assessing joint attention. So like that little rabbit or a different toy will move, and looking before it moves to see if the person will follow your gaze, if the individual will follow your gaze. It will be activities with bubbles, seeing if they'll ask to request for more bubbles. So all different types of activities that really, for most of the kids I work with, different pretend play, different tell me a story about this or show me how to do that. And it's all administered in a way that's very specific for scoring purposes. And it's really fun. Most of the kids that I have done diagnostics with actually have a lot of fun. They're different games that keep engaged. Parents are generally in the room as well, and there's different activities and things like that they'll ask for you to do. So that just kind of gives a little bit of a background. It does take a little while, and there are lots of moving parts, as you may imagine. Not all of these things are used with every individual. Again, it depends on that age and language. And so through those different things, where clinicians are looking for different skills. We're also looking for language samples, as well as looking for some of those repetitive behaviors, which can, be different finger posturing, things like that. Just observing and seeing and taking notice of some of these different things. Another component that varies depending on the clinician would be looking at some type of cognitive or language measure. And so this might be looking at some type of IQ test or intelligence test, which would be looking at that cognitive measure. Depending on the age of the learner, it may also be more of a early learning type of measure, where you get some language measures in terms of receptive language. So what do they understand, as well as expressive language. So language either vocally, or if they're using sign or a device. And then maybe even some gross motor or some of the other skills to screen for those as well. And so that has the purpose of providing more information, providing more opportunities to observe and interact with the child, as well as to kind of work again to give more information about if there's other, potentially other diagnoses or other things going on as well. If there are any questions as I go, especially I know some of this is a lot of information and there might be questions, feel free to put them in the chat. I'll keep checking too. So after an evaluation, after all of that information is collected, the clinicians will write a report, and then depending on how it's structured, they may share it with you written format. When I do diagnostics, I always do an appointment with the parents, the family, caregivers, to provide that information, what the results were, kind of talk through some of the things I observed, and give an opportunity to ask questions and to talk through like what next steps could look like. So that may be different depending again on the clinician and the way that that particular thing is set up. I do encourage families to ask questions afterwards. You may be overwhelmed in the moment. So I also recommend space to process. Give yourself some space, self-care to kind of process the information and what you're going to do next, what your family is going to do next. In terms of lots of things, when I say what one might do next, is this to access other services? Is this to potentially, does this answer some questions that you've had outstanding for a long time? Depending on, again, like what the results look like and what your goals may have been going into it. Is this something you're going to share with your child? How are you going to share it with your child? All these types of things may come up. And so it's important to give yourself some space to do that, to process, as well as your child and your family, and to ask questions about what that might look like. Let's see. I had another thought and I just lost it. And then looking at the next step. So usually those reports also encourage like these next steps. It might have resources available. Usually there's a recommendation section that has all of that. The other thing that I always remind parents and families is that when I am looking at doing a diagnosis or any type of assessment report, the goal of the report is to answer some questions. And oftentimes those questions are, is a diagnosis of autism, or is a diagnosis of whatever particular thing. I've worked in the schools previously that might look like, and to answer that question, yes or no. So for better or worse, a lot of times to answer that question, particularly to answer that question in a way that insurance is going to understand, or payers are going to understand that, yes, these deficits are there, and this individual may benefit from additional therapy or intervention. It is looking at it as a deficit model. So the report is sometimes highlight some of the things a learner can't do. And so that can be really hard. And I think sometimes it's worth reminding yourself or others that you work with, or whatever reason you're kind of listening to this webinar, that it is from a deficit-based model. And so for better or worse, that's how people access services. And so sometimes it might feel like, yeah, but my kid can do so much more. And hopefully some of that was captured and the clinician was able to celebrate some of those things with you throughout the diagnostic process. But the purpose of a diagnostic evaluation is really to highlight the things that maybe the skills that are missing that need to be worked on, or the reasons why these particular definitions in the DSM, those criteria are met. Same would be true for an evaluation if there's a diagnosis of really anything. So, attention deficit hyperactivity disorder diagnosis or whatever, it's going to highlight the behaviors and the symptoms that are observed that meet those particular criteria. So that can be difficult to read back for people. I mentioned this earlier, but get on wait lists for diagnostics. If you're interested, get in after you have a diagnostic, get on wait lists, even if you're unsure what direction you want to take. We'll talk through what that might mean, but let's say there's a recommendation to look into speech therapy. You're not sure, maybe get on a wait list. And as you think about it, because if you're spending the time thinking about some of those things, then it might be even more after you decide, hey, I want these services, and maybe even longer than to wait for them. So I do recommend that anything that you think you might be willing to entertain, to reach out and get on wait lists, and to really try to spend the time waiting and processing. Again, like maybe not like the same day you hear the news, give yourself some time to process. And get that out there, get your resources, and get those wait lists, because you can always say, you know what, I changed my mind, no thank you. That's much easier than, waiting several weeks and then being like, yes, I want to start tomorrow, and then hearing that there's a 6-month wait. Right, you could have kind of had some of that wait happen while you were still deciding which direction to go. And this could be like what type of service direction to go, or we're going to talk in one of the next slides about even setting of services, whether it's in home or in clinic, things like that. And then look to supports around you. Look to the support of your family. I know that looks different for many people. It could be your biological family or your core family. It may be your chosen family, your friends, your community. Spiritual community, whatever that looks like, groups like this, agencies like this, where there's resources available and free webinars and things like that. Look for all those supports that you have out there, the different fairs, to find out different resources. Look to those different supports or caregiver supports, things like that, to build a network. So as I mentioned, the referrals in a report could include many different areas. One of those is speech and language services. A lot of times speech therapists will work on things like feeding, which sometimes people don't realize that they may do that. But in terms of that structure of moving food in the mouth, chewing, all of that is also related to the muscles that we use for vocal speech. And so those types of services may be available, not always, but often through those types of professionals. And then also, if there's interest in using a language device, that's another area that may not always be thought of. So it's not only vocal speech, there can be other reasons and other things that speech services can provide. Occupational therapy is generally what types of the professionals that will work on any like fine motor or different self-care skills with that, or sensory issues. Many times they'll help with those types of things or have recommendations. Physical therapy for any other things that might be needing physical therapy in terms of increasing strength or mobility, movement. Applied behavior analysis, which I mentioned is the area in which I work. So activities of daily living is what that should say. And that would be, again, like the dressing, self-care, bathing, all of those things, and what is appropriate at those different ages. As individuals get older too, it might be navigating transportation, maybe transitioning between different classes at school, whatever, just like any of those kinds of things that they're going to do daily. Behavior analysis can help with. Language. So language can look like many different things. You can use pictures. So like a picture exchange communication system, or PECS, can be trained, using vocal language, encouraging echoing information back, functionally requesting in a way that, that you want to stop doing something, that you need a break, something like that. And then in general, any behaviors that we see in excess or that we're targeting to increase. So skills that we're working to develop, or if there's behaviors that are happening in excess that could be harmful, like maybe head banging or aggressive behavior, something that's happening in excess or in ways that could be harmful to the individual or to those around them. Those are other areas in which we get referrals or set goals for as well. In terms of schools, so schools generally see the 3 and up, and for those services, individuals would go through an evaluation that's different. So a part that can be frustrating for families as well is that a school system's way of kind of classifying and providing access to services is different than medical or psychological. And so there's a whole different set of different categories of being able to access those particular services. And that's all done through an assessment process and an individualized education plan, or an IEP, where the parents are part of that team and kind of setting those goals. Many of the services may look similar as the ones listed above. And, additional educational or academic services could be part of that too. Social work. Not many schools in Illinois offer like ABA services in school. It can happen occasionally. But that's something else to kind of think through in terms of what resources or tools that you may have available. So ABA is considered to be the gold standard to treat symptoms related to autism spectrum disorder. There are many studies, it's research-based, there's a lot of data to support the use of applied behavior analysis. It's considered the science of learning. I also explain to people that we all use different strategies that are similar, right, in terms of reinforcement. So if people are working, they're receiving a paycheck, that is still a kind of form of reinforcement using different visual cues. Lots of times with learners, we'll be recommending different tools like visuals or schedules, things like that. I personally rely on my Google Calendar completely and totally. And if things don't pop up and remind me, or if I don't see it in my calendar, it's it's something that I rely on, and that's using some of those different self-management strategies that are really part of that science as well. So it's really increasing different skills. It also, for many of these young learners, early intensive behavior intervention may be recommended, and up to 40 hours a week. So that's like a full-time 5-day-a-week program. That's not always true. It depends on the goals, the learner, what makes sense. Some of those little learners are still napping too. So those are all things to kind of keep in mind. And that could be an in-home program. So professionals coming to your house. It could also be a center-based program, like I mentioned, Stride is. And then there also might be school-based services as well. For ABA, it's also often recommended that the parents or caregivers are a part of that. It may include some parent training, working on strategies, extra support, and they're really an important part of the treatment team and deciding what goals make the most sense for their child. I want to also highlight and add that as a learner gets a little bit older, it's important to include them in that process as well. Include, the learner in IEP meetings through the school, include them in treatment plans, to really give them the chance to be a part of and to have that assent-based practice where they're a part of making the decisions about their own goals and their own treatment too. And of course, consistent attendance is vital for the best outcomes in ABA, or in any therapy. So just kind of thinking through what model or what might work best for your particular family, that attendance is a part of that. So if transportation is a struggle, then maybe looking at in-home, some of those different pieces. Something else I want to touch on when you're looking at ABA providers, because there is a lot of critical feedback out there about ABA. And I think that's for very good reason. And it's important to listen to the different voices and people's stories about ABA practices that may have been harmful. I also believe that that's not all ABA. So I think some things or some tips to look for is you want to find providers that are going to help your child meet meaningful goals, things that are going to make a difference. Oftentimes, this is related to self-care, toileting, having the skill of being able to independently use the restroom is very important in overall well-being and future. So that is something that I would consider a very meaningful outcome. Language, being able to express one's wants, needs, be able to tell if something hurts or is wrong, would be another. Being able to request to stop something or that somebody needs a break. And so these may be different for individuals. And so I would say to look for or ask questions of providers that are looking at things that are going to make a big difference for your learner, not just simply doing things or learning things for the sake of doing them, but that there's a reason behind it. And sometimes it's hard to see, right? Like there might be a whole process of like, we're teaching this so that we can eventually teach this and then move forward. Also allowing some space for special interests and repetitive behaviors. So I mentioned before that is a core area and a core part of what we consider a symptom. It doesn't mean that it needs to go away, right? Lots of autistic advocates have come out to say that really is part of who they are. Lots of humans, all different kinds of humans, have lots of different interests and activities, some of them that are more intense than others around them. And that is not a bad thing. And it often can be celebrated, right? I went to school for a very long time studying things that were very specific. And And that was something that was beneficial to me. And that's true of many individuals out there. And so, so those things can have space and be celebrated as well. And then honoring requests for breaks and teaching advocacy at an age appropriate level would be another thing that I would look for. Again, for that reason of not teaching learners to comply or follow through on all things that they're told, but that they also have agency and can advocate for oneself too. So let's say now you're waiting because you're waiting for services to start. So some tips on this: to prioritize your self-care, take care of yourself, prioritize, what are your goals in this moment? What can you do? What do you have control over? Catch them being good. And this is the principle of, praise, either, and learners might not all people like to be praised, but praise or provide reinforcement in a way that is meaningful to your child when they're doing things that are helpful. So if it is pointing to something or going to get something instead of having a tantrum about something that maybe they had wanted or would have done in the past, make sure you're praising and you're kind of catching that and acknowledging that. It could be a small win, and it's still important to acknowledge that. We all like to be kind of caught and told that we're doing a good job at a point here or there. And so that's true even for children. Be clear in what you're requesting. So many times, autistic individuals, it can be difficult if language is unclear or if there is a lot of language. So be very clear with what you mean to say, and say what you mean to say. And then providing a language rich environment. This could mean having lots of different language models. It could mean also reading a lot of books, but providing those different opportunities for language. And it could be multiple languages too. So if in your home maybe multiple languages are spoken, having your child's opportunity to kind of contact those various languages too, or playing with different letter toys, or looking at stories, pointing out words, any of those types of things can help with a language rich environment depending on the age and interests of the learner. And maybe those are books about their very specialized interests too. So once the ABA assessment starts, so ABA, many families will think like, oh, I want to start tomorrow. And there is a separate assessment. It's not a diagnostic, it is different, but it is an assessment that is, instead of the goal of determining the label, or if there is a diagnosis of ASD or something else, is the purpose of doing a diagnostic evaluation. The purpose of an assessment prior to starting treatment is to write a treatment plan. So it will also have like some background information, some developmental history, some of those things, generally not as intense as the other. There may also be some rating scales. There could be oftentimes an adaptive rating scale that's usually required for most assessment processes. So first, you're going to select your provider. Again, you may be looking at what type of setting, if this provider is a good fit for your family. Setting up an intake call is generally a part of it, or meeting. We offer tours of most of our centers as well. So that might be helpful to see where your child or where somebody would be learning to determine if that's an appropriate fit for you and for your family. An assessment is going to include a parent interview, generally, and then direct testing or observation to look at those goals. That could include a verbal behavior milestones assessment, which is called the VB map, or the ABLS, which is an assessment of basic language and learning skills. Very similar, but depending on the similar idea, different depending on the goals or the development of the learner. And then many times child observations. This could be to observe different behaviors, or to also language samples, things like that, to determine what the best goals are. These are just initial goals, initial plans. And so they may change and evolve over time. So the BCBA, the Board Certified Behavior Analyst, is going to draft that treatment plan. It will generally include both skill acquisition, so learning new things, as well as behavior reduction, reducing things that may be problematic, like aggressive or perhaps inappropriate for a variety of different reasons. And then usually a parent and family treatment plan or treatment guidance, maybe a parent training, a weekly parent training meeting, something like that. Then they will submit that. Sometimes they review it with you ahead of time, or it depends on kind of the order of how it works, submitting it to insurance or whatever the funding source is for approval. And then usually it'll take 4 to 6 weeks during that time, also hiring staff many times and really setting it up. And then there's reassessment every 6 months to evaluate how the goals have been going, what's been going well, what maybe didn't work out and we're not doing that goal anymore, or went really fast and much faster than expected. So that happens every 6 months, and is generally reviewed with the family. Usually there are graphs and data and all kinds of things behavior analysts find really exciting to share too. So what do the actual sessions look like? In ABA, sessions are usually directly run by registered behavior technicians. Not all places have RBTs. Sometimes there are techs that don't have that additional certification, but it requires particular competencies and certification to do. And it requires a high school diploma. Sometimes individuals also have a bachelor's degree. And then the treatment programs and those plans are written by a board certified behavior analyst who has a master's degree by definition. And quality ABA sessions should look fun. There's a lot of targets that are embedded in different play, particularly for young learners. They're presented very quickly, kind of built into different activities, maybe with a peer, maybe not, if it's in a center-based setting. And we know that all kids learn best generally when they're having fun, that it's something that they want to do, they want to continue to do. We also try our best at Stride to replicate how same-aged peers are spending their time. So that might mean some time trying to get outside, go for a walk, playing, different social play. Many of I think I have a picture a little bit later, but centers have like a slide or something, climbing structure, maybe a trampoline, things like that, that'll be a part of their play and activities as well. Focused on school readiness, especially for those early learners. Strides programming really does focus on routines. And this is true of Stride. It's true of many different ABA providers as well, particularly for those young learners, working on routines, working on, kind of following a schedule. What happens if there's a change, something we didn't expect? That can be really hard for all of us. Working through different transitions to different spaces to work with different individuals, coming in, hanging up your backpack, hanging up your coat, going to wash your hands. Any of those different types of routines to transition can be helpful and can be worked on, including toileting, eating lunch, all of that. And then group learning and social skills. So we utilize like a circle time with different songs, maybe going through the calendar. It depends a little bit depending on that particular group, but we use a lot of that time where learners might be together looking at the weather. It looks very much like a preschool type setting, getting ready for kindergarten or beyond. And then treatment goals may be worked on even in that group setting, and many times it's a one-to-one. So there's one therapist working with that learner throughout the sessions, and then there may be opportunities where there's group 2, which is helping kind of work towards that increased independence. And those treatment goals are based on, again, those ongoing assessments. So at Stride, we kind of have these different steps for success, which are helpful both in our center as well as for families. And so we're shaping approximations. We're kind of working towards gradually building on goals. I've talked about a lot of these already, so I'm just going to kind of highlight the review. Teaching for generalization, so practicing across different settings, having different therapists or teachers type of teaching, working with parents to generalize, to have some of these skills work in home. One of those main examples that we do is like when we go through a toileting protocol, how we're very mindful about how we're working on that in the center, but then how is that going to transition to home? How is that going to transition if that learner is also in school and with a school team? So kind of thinking through how that's going to work. Anything that's socially significant, we should be providing reinforcement for. So any type of, language, they're going to play near somebody else, or they said hi to a friend, whatever, to work on increasing those, even if we're not specifically, that's not a specific goal that's targeted for that particular learner. Incorporating different types of learning opportunities. So learning at a table is what many people think about, but maybe not. Maybe you're sitting on the floor, maybe you're running around the center, be all different things. Making decisions based on data. So we, and many ABA companies now use electronic data collection systems where we're collecting information and it's automatically graphing. And so then the board certified behavior analyst can make decisions based on goals and treatment, based on the data, not just like, hey, we think maybe we should change this, but why are we looking at changing this? Are they making progress? We thought they were, but maybe they're not. So making sure that we're making decisions through that. And then encouraging communication for what they want, encouraging it in whatever way makes sense for that learner. So it may be vocal, it may be a vocal approximation, it could be a gesture, it could be using pictures, but any type of communication, making sure that we're working through that and that we expect that of our staff and of families too, to increase communication across everybody, as well as even increasing communication with other providers. Many learners who are in ABA are also in speech, are also in OT. And so working to increase communication, to coordinate treatment plans as much as possible for the kids and their families. So for Stride, these are our current Chicago area locations. So we have locations open in the South Loop and in Hickory Hills currently. And like I mentioned, we would do tours if people are interested in services. And then Orland Park is a newer center for us. And we do have immediate openings, and we have an event coming up, which I'm going to just kind of plug in a second. And then we are opening, hopefully in early summer, a new clinic in Downers Grove as well. So if anyone has any questions about any of those areas or things, I'm happy to answer those too. Any questions?